Can't fool myself, I don't want nobody else to ever love me. You are my shining star, my guiding light, my love fantasy. There's not a minute, hour, day, or night that I don't love you. You're at the top of my list, cause I'm always thinking of you. Okay, so that's my thing. I just sing whatever old school song is in my head when I press the go live button. You know, sometimes people just sit here and look really crazy at the camera when they're waiting for people to come in. I mean, why not sing some Luther? Darnaro Evans is here. Hey, boo, how you doing today? Nikki Thomas in the afternoon on 102.9 KBLX. Live on the radio, live on the internet. It is time for our health mixer sponsored by Covered California. Oh, Darnaro singing with me. Oh, my love. A million days in your arms is never too much. Kimberly Wingfield is in the building too. All right. 1,000 kisses is never too much. That's how you know it's a good love song right there. Okay, so let's go ahead and get this started because I've got some serious information for you right now, KBLX Nation. Go ahead and share this video. Share this video because somebody in your friends list need this information that I have for you this afternoon. All right. So having health insurance today has never been more important as our communities are ravaged by COVID-19. Hey, Shirley Andrews. Hey, Mookie. How you doing? Everybody's singing the Luther along with me. This is so amazing. All right. So for many years, a trusted resource for getting insurance and health care has been Covered California, the agency established under the Affordable Care Act, aka Obamacare. Just giving you the backstory here. With us today with important information is Marshawn Harris, who is a Covered California certified insurance agent here in the San Francisco Bay Area.
Hi, Nikki. Thank you.
Welcome. Welcome. You look amazing.
Thank you.
And you know, you look like a person that we want to be on the other end of the phone when we call for information. And we love knowing that you're hard at work.
Well, absolutely. I'm working the phone and I'm there for you.
And one more thing, Marshawn. Okay. Happy birthday to you. Happy birthday to you. I hear it's your birthday today.
It is. It's my awesome 48th birthday. So, as you say, I'm working on it. So,
look at this. It's amazing, working hard on her birthday. This is the Aquarian energy, but you always know that you're in good hands.
Yeah,
when you're with an Aquarian. So you're with 2 Aquarians right now. You're having a good day. It's a good day. Yes, Mookie says happy birthday as well. Kimberly says happy birthday. Look at the whole KBLX Nation here. Nothing but love in the building. All right.
I appreciate it.
This is amazing. This is amazing. So yeah, we're so glad that you're spending your special day with us. All right. So let's go ahead and jump in with this information. What are the important dates that we need to know for enrolling in Covered California health plans for 2021? Because we hear information all the time. Tell us what we need to know.
So our important dates are, again, January 31st. So we have open enrollment. We're in the middle of open enrollment. That means that anyone can enroll. You don't need to have an excuse or any type of thing going on. You don't have to have lost your coverage or anything else. If you just want to enroll in a healthcare plan, you can do that without any questions. So but that ends on January 31st. So if you want a February 1st effective date, you must get everything enrolled and selected a plan. And actually, you probably should pay for the plan too. So it can start on February 1st. So that's our first important date. Now, our second important date is our new president has extended the open enrollment, special enrollment period for healthcare.gov, which that's everybody else besides California, but Covered California wants to be in step with that. And so we have another special enrollment, which starts on February 1st and ends on May 15th. I just got this. He this just came hot off the presses this morning, actually. So I'm also trying to remember our dates. But May 15th. So during that period of time, if you've been laid off due to COVID, laid off due to your income decrease, or anything due to COVID, or you just need health insurance, you will be able to enroll. It won't be start on February 1st. It'll start on some other dates, depending on when you enroll. But you have till May 15th. So we're going to be in step with our president and actually extend the special enrollment reasons. Now, there are other special enrollment reasons, but I just want to make sure you note that one in your book. So you still have time, but I would not procrastinate. You do not know when you will get sick. So let's get it done for January 31st.
Oh, you better preach. You don't know when or how or what could happen health-wise. We live in crazy times right now. So yeah, I would go ahead and encourage people to go ahead and get that process started ASAP. So like to hit this January 31st deadline, you still got a couple of days. So this is why this is a very timely information session that we're having today. So why is it important for African Americans and other people of color to get health insurance right now?
Well, to be honest, during this period of time of COVID-19, we are seeing that people of color, and particularly African Americans and Hispanics, are being hospitalized at a higher rate. They are, passing away from COVID, and we don't want that to happen because they don't have the access to good health care. So it is important for African Americans and as well as Hispanic Americans to actually not only get health insurance, but actually get tested. You do the COVID testing, and that's free. And also to be vaccinated, and that is also free. So all plans, everyone can be vaccinated and tested for free. So we don't want to that's not a barrier. But then we want to make sure that you're able to just go to the doctor if you think you might be sick. Even if we think we might be sick, we want to make sure that, there's more than COVID-19 out there. There's other diseases, illnesses that need to be treated. And we want to make sure that we're not the last in line to be treated, or that we come into the hospital sicker than we need to be when we can be treated earlier. So that's why.
Absolutely. Absolutely. Okay. So sometimes when we say healthcare, health coverage, it's like we all like shudder a little bit because the next thing is like, okay, that's expensive. How can people save money on a covered California health plan or a Medi-Cal health plan? And this is really important right here because we want to clear up a lot of the fear around the price and how expensive it is or isn't.
Well, like most of the people who are working with Covered California receive a discount on their healthcare plan. It's not as expensive as people think, particularly if you are on the lower income. There with Medi-Cal, it can be free. And then with Covered California, we have plans that go from $1 a month based on your age, your income, and your zip code, and number of tax dependents on your federal tax returns. But it could also be full price. It just depends. But the big thing is you must actually call and speak to someone. You have to actually put in the numbers in the computer system so we can actually give you some facts, because you would not believe how many people I speak to who's been going without insurance for the last couple of years, and they could have had insurance for $30 or $40 a month in their budget.
Wow.
They did not inquire. So I encourage you to actually inquire. Even if you think it's expensive, even if you got a quote last year, this is the time to reach out, ask the question. You're not annoying us or anything else. This is the time to make that inquiry about how much it costs. Don't assume.
This is very good information here. Okay, so can you expand on how people can apply for health coverage for 2021? Because folks are asking for like website, phone number.
Absolutely. So the first thing I'm going to do is offer my service. My services are free to use. So my phone number is 510-682-4949. That's 510-682-4949. There is a team of people who are standing by to take your call.
Mhm.
And the second thing is you can go to the website coveredca.com, coveredca.com, not .gov, but .com. So
Mhm.
those are some ways. If you go to the website, there's other ways also. You can call the 1-800 number and also speak to on-demand agents. But the bottom line is there is assistance, and you can either call, go to the website, and there's someone to walk you through. It does not cost you anything. If anyone's asking you for money, hang up the phone, and well, they're going to ask you for money for the premium. Got to pay the premium yourself. But if they're asking you for money for their services, then just hang up the phone and call again.
Mhm.
Okay.
Mhm. So if they call you, they know they have the right person, and you have the
Yeah,
information.
well, if you call me, absolutely, you have the right person.
Right. And you know, you're there to help. That's the thing. You're there to help. And you know, sometimes, I don't know, this just came up for me. Sometimes it feels like nobody's there to help us when we need help, but that's absolutely not the case. You know, here in the Bay Area, you know, this is a place that creates safe space for people. So, you know, that's an amazing story you just told us about. Hey, there's affordable plans. You know, this plan could have been $30 or $40, and it certainly could have changed a whole lot of things. So, you know, I just want to put that out there. So the phone number, so coveredca.com, or the phone number is 510-682-4949. All right. So look at it. People calling you already.
I'm sorry about that. It's like the phone's
Well, you
going
know, KBLX Nation, we like to do that because I know we like, I'm watching you on the internet right now, girl. Can I get some information?
out. Just give me
Fast action.
there.
Fast action KBLX Nation right there. Okay, so new covered CA health plans include coverage for COVID-19 testing and vaccination. And how important is it for people of color to get vaccinated when it's available? Because this is another hurdle here.
Absolutely. So again, it is included in the health plans. It is free. Even if you go to some of the major testing sites and you belong to a different health plan, it's still going to be free. So you know that should not be a barrier. The other thing is the health plans they're able to assist you in sometimes in finding where you can get COVID testing. I know that is a barrier. In terms of African Americans, we want to make sure that we are vaccinated. We're getting vaccinated. We know the history, but the bottom line is this vaccine has been tested, and we have, there's millions of people at this point who have actually received the vaccine. So let's make sure we go out and, also get tested. We don't want to rely too much on what we read on the internet, and because sometimes there's conspiracy theories out there. So we want to make sure we have facts. If you want to do some more research, feel free to do some more research. But we want to make sure that we're receiving a vaccine like everyone else. And Covered California is working with various carriers to make sure they bring that into our community. So, definitely ask questions, and definitely we'll get that information to you. So.
This is amazing, amazing. We're speaking to Marshawn, who's given us the whole rundown on Covered California, and in a very timely fashion because the first enrollment deadline is January 31st. And you absolutely want to kind of jump in as early as you can because you can start your coverage on February 1st. And the great thing is that this is Marshawn's job to help you find an affordable plan for you. So you call her, give her your information, and she will say, we have just the thing. And she'll make it easy for you. This is my favorite part, that you're going to make it easy for us to get the health coverage that we need. And she's the birthday girl. So y'all can still be sending her some good Aquarian birthday love. John Deans, I see you. All right. So Let's keep it going. What kind of benefits do you get when you're enrolled in Covered Sierra or Medi-Cal health plans?
Okay, so all of our plans actually include full coverage. That was one of the mandates of the Affordable Care Act. So we include, preventive care. So those well woman exams, your annual physicals, um, anything that is required based on age and just to test. Those are usually included, and there some of those things. The preventive care is actually free. So even if you have a plan with a high deductible, your preventive care is always going to be free. With Covered California, there's various copays and coinsurance for different procedures, but everything is included, including high blood pressure testing, um, cancer testing of all types. There is if you're pregnant, of course, you need a birth plan and a doctor. And if you have children, pediatrics is usually covered if your child is actually of age and you actually meet the income guidelines for Cover California. That would be included in there.
Mhm.
So there is a lot of coverage. It's full coverage, and if you have Medi-Cal. In Medi-Cal, it's actually dental and vision are included. It's limited dental and vision, but it's included in the plan. If it's Covered California, you may be able to purchase dental and vision. And for children, dental and vision is always included in the plan. So it's full coverage, basically.
Okay, amazing. All right, so so much has happened in the last year. We forget certain details, but do you have to have health insurance in 2021? Is there a penalty if you don't?
So on the federal level, there is the penalty is zero. So the requirement to have health insurance never went away. The penalty went down to zero. In the state of California, if you are a resident of California, you are required to have health insurance or you will actually face a penalty. So sometimes people get a little bit confused because we had one thing going on the federal level, and then we have another thing going on with the state. But you will face a penalty and you will see it on your state taxes. So definitely get insured. You can only be uninsured for 3 months. That penalty is $7.95 per adult for the full year. Can be prorated and it's usually half for a child. So the question becomes, why give the state of California money for nothing? I mean, so at least if you pay for your health plan, you actually get something for it, right? So, and that's a lot of money to actually just go out and pay in a lump sum. And they don't have as many grace periods, I'm told, in terms of the tax people. So we want to make sure that we actually get something for our funds. And more importantly, if you actually, you don't have health insurance and you take that risk and you say, oh, the penalty, I'd rather pay for the penalty. At the end of the day, if something happens to you and you're walking down the street, and you fall out, you have no control over who calls the ambulance on your behalf. That ambulance ride could be $2,000 to $2,500 right there.
Wow.
That's not you hitting the emergency room. So sometimes we have to actually think a little bit more than the here and now, because some things we have no control over, and the bills that can arise from that can cause us more anxiety than it would be for us to just actually purchase a plan that is within our budget. We're not asking you to go so far out of your budget, but still trying to get you a plan within your budget. But you know what? Some of the stuff of just, the ambulance ride, emergency room, that stuff is not in our budget. That's not in a lot of people's budget. So why take on that extra stress? So there is a penalty, but more importantly, make sure you just make a decision that is in favor of you overall in the future and your financial health, as well as your physical health.
Yeah, you won't have to worry about the penalty if you just kind of follow all this great information that we're giving you this evening.
Absolutely.
Absolutely. Okay. So, any closing remarks? Let's just kind of do some closing remarks here and review, give everybody the information again.
Okay. Well, the first thing we want to review is January 31st is the deadline for is the ending of open enrollment. So if you want coverage starting February 1st, I need you to probably start before 11 p.m. on January 31st and start the enrollment process. So it is January 28th. So if you start today or tomorrow, you're doing great.
Yeah.
And if you just can't get to it, midnight is your deadline. So for January 31st, that's the first deadline.
And let me ask you this, like when they call you, what should they have on hand? Because okay, I saw Marshawn on KVLX. I'm gonna call and do this. What would I have in front of me to make the whole process easier for you?
So I would need your contact information, obviously, your income information, and let me do emphasize that a little bit more. I am looking for a projected 2021 income information. And that's a little bit confusing some people because it's like I don't work a regular work week, or I don't or last year I made a lot of money, this year I don't make that much. We are looking for you to project, basically to look at what's going on today, this month, this week, and then project out for the year. You can change that income number, but we do need that particular information. So I'm not looking for your 2019 tax returns because that may not reflect what's going on right today, which is you might be on unemployment and 2019 might have been, the best year ever. So we are looking for current information. If you are an immigrant or a naturalized citizen, we do need that information, green card information, citizenship numbers, that type of information we do need. It doesn't really matter about your status and per se, as long as you're here with legal, you're here legally, but we do need that particular information. But it will not prevent you from getting coverage. We also would need dependents information. In particular, a lot of times people don't have their children's social security numbers and things like that. So that is also the information we would need. But other than that, not much.
Okay. I think we can do that because I don't know. I like to run through all the obstacles that folks might have, and sometimes just you thinking that something needs to happen might slow you down in the process. Oh, I don't have all my tax info. So you're saying, hey, no, that's not what we need. It's just very generic, straightforward. And from this, small pieces of information here, you can give them the help that they need and, give them an idea of, the plan.
Well, I could give you a price based on your age, your income, and your zip code and number of tax dependents. So that part you don't need. I think you know that off the top of your head. In terms of enrollment, actually, I tell people, even if you don't have all that information, first let's start and get an idea of what you actually need. Because sometimes we need that information maybe 2 or 3 months from now, because you sometimes are required to have proof of income or proof of immigration. Sometimes there's a delay on that. So there is time for you to get that in. So just still, I encourage you to give us a call first. Again, give us a call first, figure it out with us, and I'll figure it out with you. And then that way we work on facts.
Awesome. So how long will a phone call last when we call you?
If you're calling me, you're going to be there probably an hour, no more than an hour, usually, unless you're asking questions. But usually I can get an application done within 45 minutes to an hour. So that's usually how long the phone call lasts. But the thing is, I'm not there to necessarily rush you. It's just that I know the application. So I know what questions I'm asking.
Right there. Aquarian magic. It's like 45 minutes, baby. And we're going to get this figured out.
Absolutely.
I love it. I love it. Okay, so free confidential help to enroll in Covered California and Medi-Cal health plans. If you did not catch the information, coveredca.com. You can go to the website, or you can call 510-682-4949. That's 510-682-4949. This is your health mixer sponsored by Covered California. All the information you need. And thank you so much, Marshawn, because this is like, it seems like no brainer easy. It's like, hey, call, have this top of mind information ready, and someone can help you navigate the process. I love that, you are like working hard on your birthday and that you have all this great information for us.
Well, thank you. And I first of all, I appreciate you having me on again. Each year, it seems like, we already know the information. Everybody should know the information, but each year there's somebody different that we reach, particularly that we reach in the African American community who may not have known. And one of the reasons why I tend to love this job that I do is I know that I have many times sat on the phone with people who actually have cried because they just were very frustrated with the whole thing. They needed, coverage. They needed mental health coverage, and they did not know where to turn. And one of the things I get to do as an agent is make it very simple for you and to make sure that you get all the way through the beginning and the middle and the end of the process. And we're able to do it with a personal touch because, again, I don't have an agenda of making money per se off of you. We do get paid, but you don't pay us, so it's fine. So our goal is to make sure you have the appropriate coverage and something that will meet your needs. So
amazing. I feel better about everything now. Not just health coverage, but everything, Marshawn, because you've just blessed us with this wonderful energy. Thank you so much for checking this out, KBLX Nation. Please share this to your page and let somebody on your list, know that there is free help or confidential free help to get your coverage together. And we got a couple days to make it happen. This is awesomeness. Marshawn Harris, Covered California certified insurance agent in the San Francisco Bay Area. Thank you so much, sis. Have a wonderful rest of your birthday. Thank you for doing what you do. And I'm going to let you get back to the job because I know you're going to be busy for the next couple of days, right?
Yes, I will be busy. And then I will celebrate in February.
So what she's saying is that she's going to work, and then the rest of February, she's not going to act right. That's your mantra right there.
Yes.
That's how we do. Thank you so much, sis. Covered California Health Mixer, Nikki.